Welcome to Taking Charge of my podcast, episode 9. I am Dorly Munoz, your host. I am so excited to have one of the most amazing and humble physicians that I ever worked with, Dr. Dhruv Singhal. So Dr. Singhal is a physician and associate professor of surgery of Harvard Medical School and served as a co-director of the Boston Lymphatic Center and a director of the Beth Israel Decadence Medical Center Lymphatic Center. He completed all his formal surgical training in Boston. He's a board certified in general surgery, having completed this at the Brigham, a women's hospital in Boston. And he's also board certified in plastic and reconstructive surgery, having completed further training in plastic surgery in the Harvard Combined Plastic Surgery Program. Then he pursued a fellowship in adult craniofacial surgery at the Chang Gung Memorial Hospital in Taiwan and a microsurgery at the China Medical University Hospital in Taiwan as well. His focus is cancer reconstruction. Dr. Singhal is a pioneer in immediate lymphatic reconstruction for the prevention of lymphedema in high-risk patients and performs liposuction, lymphovenous bypass, and a lymph node transplantation for the treatment of chronic lymphedema. Dr. Singhal also performs an entire gambit of breast reconstruction from oncoplasty procedures to perforator flap operations like DIPs, flaps. Dr. Singhal research focused in one lymphatic reconstruction. In 2021, he was awarded OR1 from the NH to further delineate the functional lymphatic anatomy of the upper extremity. In 2022, he was awarded a grant to lead a team to map the human lymphatic system for the Human Biomolecular Atlas program at the NIH. So it's a pleasure to have you here, Dr. Singhal. Thank you for doing this with us.
Shirley, it is my honor to be here. And I gotta just say, I miss you. I miss working with you on a day-to-day basis. It was you, Lisa, and me, back in, when was that? 2013, when we started a lymphatic program at the University of Florida. And that's where it all began. I miss you. And I have to say, when you called me to do this humbly, I was so proud of you. You're always a go-getter. And now you're doing a podcast. I'm proud of you. I miss you. And thanks for having me.
Thank you so much. We miss you a lot. I think about you every day. Every time I see a patient, like, oh my God, if only Dr. Singhal will be here. I want you to go to Boston and see him. So you're amazing. So thank you again.
Well, you're always welcome in Boston, really.
I know. One of these days, I'll take your word and then I'll be like, hello, here I am. Okay.
We're waiting.
So you want to tell us about your mission, how you end up doing all the wonderful things that you're doing?
Well, thanks, Zoe. My mission in one word from a career perspective is, my passion. I'm a plastic surgeon. I'm a reconstructive plastic surgeon. So 99% of my patients are cancer patients. And, there's a big blind spot in medicine and lymphatics and the disease of lymphedema, which is one of the most significant cancer survivorship issues in developed countries. And briefly, lymphedema is a swelling. Usually it can occur anywhere in the body, but usually of an extremity following cancer treatment. That's the number one cause of it, again, in developed countries. And my mission is to eradicate lymphedema as a sequela from cancer. It's the number one cause of lymphedema is usually surgical treatment of cancer. That's the number one risk factor. And so it occurs in the operating room. The insult occurs in the operating room. And I believe there are surgical maneuvers and procedures that can be performed to mitigate that risk. And that's really become my passion. As you know, we started this together back in 2013. And that's remained my mission. And it's really the core of my clinical practice as well as our research.
Excellent. Very good. Were you always planning to do this?
It's funny. I wasn't. I trained in the Harvard Combined Plastics program up here in Boston, and I was initially enthralled with face transplantation, which also requires complex microsurgical reconstruction. And I went to Taiwan to do my fellowship. A few people know Taiwan. Chang Gung Memorial has the largest plastic surgery unit, one of the largest plastic surgery units in the world. It was started in the 1950s by an American Dr. Sam Nordoff, and they just have turned out so many leaders in plastic surgery. So I went to spend a year and a half there to kind of develop my own fellowship, learning more about the adult face and also complex microsurgery. And while I was there, lymphatic surgery kind of hit me in the face. They were doing lymphatic surgery really for patients with cancer and who had lymphedema post cancer treatment. And I had never seen this before, and I was completely enthralled. And when my first faculty position came up with you at the University of Florida, it was one of the programs I said I wanted to start and look into. And when the word got out that we were doing lymphatic surgery, as you know, people started coming from everywhere. And I think in medicine, they call it the practice of medicine for a reason. It truly is a practice. You get better with the more you see, the more patients you listen to, the more patients you treat, and then listen to them and hear how they're doing. As we went through this journey together for
Yep.
so many years. And it just became like, I think you and I honestly traveled through this journey, and Lisa together. Lisa Spiegel, obviously, the lead breast surgeon at the University of Florida, where we just became so amazed by these patients, what they were going through,
Mhm.
and also kind of amazed with what they had and what they could have, and the belief that we could do better for them. And I think that's what's really driven me and driven you clearly um, into this more than anything else. For me, I see the most potential here to help so many patients, and that's really what has kept me in this. And I foresee the rest of my career really being focused on lymphatics.
Yeah, and it's amazing, Dr. Singhal, how I have seen you, like you've been doing amazing things. I've been going back to the seminars that you're putting together for lymphedema, and it is amazing the stuff that you do. You're all over the place. I mean, all the stuff you're doing now, like to try to do lymphatic with MLD and ICG, all those kind of things that the Australians are doing. Like it's amazing. It's just kind of your passion is just, I don't think we can ever fill the shoes ever. We haven't since you left. So it is just amazing.
Billy, you're very kind, but let's just take what you just said and let's just dive into it a little bit more, okay? You said, look, Dhruv, your team is now doing ICG guided MLD, okay? So we're doing this technique where we're bringing patients right into our clinic. We now have a dedicated room in our clinic where we'll do near-infrared imaging of the lymphatic system, see it in real time, and looking at the lymphatic system in real time, we will offer guided MLD, which is MLD, manual lymphatic drainage. You know better than anybody. It's a technique offered by certified lymphedema therapists, occupational therapists, to guide lymphatic fluid in patients who have lymphatic dysfunction.
Exactly.
But you're giving me all the credit for this. and really, I have been blessed, and you know this. I have been blessed with working with incredible teams. Do you know who does ICG guided MLD in our center? It's not me. It's Elizabeth Tillotson, my nurse practitioner, Emily Muller, one of our certified lymphedema therapists. I've been surrounded by incredible teams throughout my career. And so, when people give me credit, it doesn't belong to me. It belongs to the team. Just like when I was in Florida, none of this would have happened without you, Lisa, the support we had to make it happen. So thank you for that. But at the same time, this doesn't happen without incredible teams working together.
You're right, but you have to have somebody who drives that passion and that team. And if you don't have the driver, then the team is not there, right? So I don't think that passion and that driver come from anybody. And you know that. I've been telling you this many years. So, but yeah, that's awesome. So will you give us 3 valuable tips that you have learned about your journey?
Yeah, and I really want to gear this towards the patients in the audience, and particularly patients who are dealing with cancer right now, or patients who have survived cancer and it's in the rearview mirror. Um, but then dealing maybe with some of the sequelae of cancer treatment. I think the first thing is allow yourself to be loved. Okay, I think in our society we are we are taught to be strong, plow through life and just do it. And there are times when we are all vulnerable, and it's okay to let your guard down. It's
Yep.
okay to let the people around you help you.
Yep.
Trust me, the time will come where you will help them, and they will have their own suffering that they're going through. So that's one thing, just having seen thousands of patients in the clinic and talking to them. It's one of the greatest um, experiences as a physician is you in a very short window of time you dive into people's lives because it's understanding who they are and where they're coming from and their support is very important. Uh, Taking care of them. And it's one of the things I've seen over and over again. And I have to, remind my patients, allow yourself to be loved, allow the people around you to help you. Trust me, you will get the chance one day to return the favor. I think another thing, and I don't know if there's a pearl of wisdom in this, but I think the recognition of this is that the unknown is one of the hardest things to deal with
Mhm.
for for patients.
Yep.
And
Absolutely.
that's a normal response. It's sometimes easier to tell a patient bad news than it is to say, I don't know.
Yep.
And the reality is, there's a lot of I don't knows in medicine. And in a cancer patient's journey, there's a lot of periods of time where there's I don't knows. You're waiting for pathology results, you're
Yep.
waiting for a certain outcome. And that can be a very challenging time. You're not alone. I want patients out there to know that is a very challenging thing to work through. Um, and but there is almost always a light at the end of that tunnel. So just persevere. And finally is believe in yourself. Believe in what you can accomplish, what your body can accomplish. Um, I do believe um, that one's ability to persevere is very important. It doesn't mean you can't cry. It doesn't mean you can't be angry. But through all of that is also perseverance. And I do believe that believing in oneself is critical. Uh, and I think those are the three things that I would just say, off the top of my head, really, I think patients that I would want patients to think about as they go through their own journey.
Perfect. Very great, valuable tips. And I see that all the time. So thank you for that. How about your most painful lesson that you have learned in your journey?
And as I think about this one, and this one you and I talked briefly about earlier, and I'm going to get a little personal on this one in terms of my own journey. I have a vocal cord disorder, and so when I was 21, I was diagnosed with polyps in my cords. I ended up having 5 surgeries in 5 months, and 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 I remember when I was deciding how aggressive to be with my surgeon at the time. Um, Huddled together with my supports, or my parents, my brothers, you know, and we talked about all the options. There was an option to save my voice, but potentially deal with um, the polyp coming back, or being aggressive and not coming back. And we made a decision to be aggressive, and with the understanding that I would never have a normal voice again. And that has been understanding that this my voice will never be whole again, and everything that comes with that. It's a painful lesson. It's a painful lesson. Every time I open my mouth, it can be a reminder. But in this, you also find strength. I have found that painful lesson for me, making me a better physician every day. Understanding that the body is sacred. The physical body, the
Mm.
emotional body, of course, but the physical body is sacred. Once you change it, you can't get that back. Um, so for me, I've turned it into a strength in that, it allows me to connect with my patients better. It allows me to understand their own journey. And not that I equate my disorder with what they're going through, but the themes can be similar. Um, and so, yeah, I think that's a painful lesson, but one that I've worked through over the last 20, 25 years. And I believe has made me stronger, and I hope has helped me help others.
That's awesome. Thank you for sharing that. Is anything that you have that will be a value for our audience, and will you share it with us?
Yeah, there's a lot of places we can go here, but I'm going to slip back into kind of some of the work we're doing on the clinical and research side. Um, I really believe, and this goes back to the mission, I really want to eradicate lymphatic disease from cancer patients. That's the first place I want to start, because I think there's a known time when the injury there's a known time when the disease is started, in a way, or the process leading to the disease. And I really think that better understanding, better understanding of lymphatic anatomy is going to be the key to the future of preventing this disease. And I just want to explain a little bit about what I see the future as. I see the future as a patient gets a new diagnosis, and let's just take breast cancer for an example.
Mm-hmm.
But this can also be a gynecologic cancer, a melanoma, urologic cancer. But for now, let's just stick to breast cancer. A woman comes in newly diagnosed with breast cancer, and what we're going to do is we're going to do an imaging. We're going to do ICG lymphography, near-infrared imaging, right there in the clinic. A few quick injections, relatively painless. We're going to image, map a woman's lymphatic anatomy. And in doing so, we're going to know what her risk of lymphedema is. And if she's at high risk for developing lymphedema, we're going to inform the cancer team. We're going to put them on alert. They may take a different approach to her care, or we're going to be very aggressive in what we do in the operating room to prevent the disease out of the gates. I really think this is coming, and I think I want this to be on the minds not only of medical care providers, but also patients,
That's awesome.
that this is coming.
That's awesome. That's super exciting. Oh my God, that's super exciting. That's great.
I'm excited.
Yes, yes, it's all about prevention, right? That's why the LV bypass has been, at the time of surgery, has been such a great outcomes. We're still having great outcomes here as well. So
Same here in Boston. I mean, we've continued the work, and it's been kind of nice to see the work continue in parallel.
mhm,
You and Dr. Spiegel, Lisa, doing great work, publishing your results. We're doing sharing a parallel track up here in Boston, and it's so important when you are doing this that you share what you're doing, and you have to be forthright, completely honest. You have to share the good and the bad, because at
mhm.
the end of the day, it's about the practice of medicine. It's our job, it's our duty to make things better for the next decade and the decade after, and for generations to come.
Awesome. How can people find you?
So I'm not that connected as I probably should be, but I do have a Twitter account at Dr. Dhruv Singhal, and that's one way I'd love to connect.
Perfect. And so people know he works at Boston at Beth Israel. So if you ever need to get him there, that's how you can find him. But I will put all his information on the podcast description. Um, is any 3 books that you will recommend for our audience?
Yeah, all right, 3 books. So, you probably asked the question you don't want to ask me, Darlie, because somebody once asked me if you, they told me one of their interview questions. I forget if I think this was general surgery residents, was um, they would ask a candidate if they walked into a bookstore, which section of the bookstore would they go to first?
Okay.
And if you ask me, the section I would go to is self-help. I always like reading books to make me better. And so one of the books I would say, is Autobiography of a Yogi. It's by a yogi, Paramahansa Yogananda. And I actually read this book when I was in a really dark time in my own life. I was a chief resident in general surgery at Brigham Women's Hospital. I was flying 1,000 miles a minute. I was in my last year of general surgery training. I had just run the Boston Marathon, and I was running outside in the cold weather, and I had borne an ulcer through my vocal cords because, again, that part of my body will never be normal again. It's a vulnerable part of my body, and I had an ulcer on my vocal cords. And my laryngologist told me that if I walked back into the hospital, he was going to call the chair of surgery and have me fired. I needed to go on a month of voice rest. So for a full month, I couldn't talk.
Oh,
I
wow.
couldn't even go out because I couldn't interact with anybody. So I had to sit in my apartment. My fiance, now wife, Becca, took amazing care of me. But I was alone all day. I was alone, and I read this book. And this yogi actually introduced yoga to the Western world and the U.S. And he really talks about spirituality, and spirituality is how we connect with the unknown. And that is, and for me, the unknown is God. You know, and one of the things I took away from the book is just be humble. No matter what you accomplish in your life or where you are, do your own dishes. You know, vacuum your house. You know, just 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 be a human being. And I think that's, you know, just be kind. It's just very simple lessons from such a great man. And I think that's one of the more powerful books that I've read. So that's a book I would recommend.
Awesome. That's
And
great.
do you want me to go through more?
Yeah, we can go to one more. Yep.
Okay, one more. I think another one I think is Grit. Grit is by Angela Duckworth. She's, I believe, from the Warren School. Um, and she talks about the importance of perseverance. And she's actually find ways to objectify this, quantify it. And she talks about the importance of grit for success. It's probably more important than anything else.
Yeah.
Intelligence. It's ultimately about perseverance. And the translation of this into medicine is clear to me. It's a one-to-one translation. Again, believing in yourself and perseverance.
That's awesome. How about, I know you've been traveling all over the place for fun and as well a lot of your research and your experience. What will be a couple of top places that you will advise people to go, or places that you feel that, wow, this is like an amazing place? And I know every place is amazing in the way, but what will be your highlights?
So I'll give two right off the bat. One is Taiwan. I lived in Taiwan Becca, my wife, and I lived in Taiwan for a year and a half. These are some of the kindest people you'll find on the face of the planet. They have a beautiful country, from Taipei, obviously up north, to uh, to their national forests on the eastern coast. It's a gem in the world. It's worth the visit. Make sure you visit all of it. Not just the urban sites, but also the rural sites. And I think you'll walk away with wonder. And I just have to say a place actually I visited when I was in Taiwan, and it's one of the most beautiful places I think on earth is New Zealand, specifically the South Island, um, Milford Sound, Kaikoura. Just if you enjoy being in nature and connecting with nature, I have never connected with nature like I did when I was on the South Island in New Zealand. So that's another place that I would just highly recommend for travel.
Awesome. Yes, one question you wish I will have you ask you that you have answered. Any last tip that you wanna tell our audience before I let you go?
You know, no, just I think I would just want to re-emphasize one thing: allow yourself to be loved. You know, it's so important. We I believe we're all good. We're all great inside, and we all give good. We all give love. Allow yourself to be vulnerable. Allow yourself to be loved. Um, and it's the circle of life. If you do it, you'll give back. And honestly, the world will be a better place. Your own experience will be better. Um, and I just think it's really important.
That's amazing. Well, Dr. Singhal, has been a pleasure seeing you, talking to you. Thank you for being part of this show. It's always amazing seeing you and talking to you, and we can talk for hours, as you know that, for
Yeah,
everything.
absolutely, Darlene. And back to where we started, we miss you. I miss you. And I can't wait to give you a hug the next time we see each other in person.
Awesome. Thank you so much, and you have a great day.
You too.